you about type 1 juvenile diabetes. So the first question, well, it is an autoimmune disorder where the immune system attacks and destroys the insulin-producing beta cells in the pancreas. When that happens, the pancreas is no longer able to produce insulin, and therefore the sugar stays in the blood and can cause major damage to the body. It can cause kidney damage, it can cause liver problems, it can cause the body just to shut down and go into what they call DKA, diabetic ketoacidosis, which could be deadly. There is no cure for type 1 juvenile diabetes. Insulin has to be delivered either by a pump or manually by shots. The next thing we'll talk about are the symptoms of type 1 diabetes. I think these symptoms are very important to pay attention to because they mimic things like strep, the flu, stomach virus, when in all actuality someone could be suffering from type 1 juvenile diabetes. Some common symptoms: excessive thirst, weight loss, headaches, stomach pain, irritability, bedwetting, fatigue, increased appetite, and that's just naming a few. As far as treatment is concerned for type 1 diabetes, you have insulin. Insulin must be administered every time a person eats. It could either be manually by shots or through an insulin pump. With technology, we are progressing where now we have constant glucose monitors where you don't have to prick your finger 4 to 6 times a day because you're supposed to prick your finger every time before you eat. Now we have technology where we get real-time data that's being sent via Bluetooth to either phone, smartwatches, and so people are able to monitor their blood sugars. I also want to share with you today a little bit about my son's story on how he got diagnosed and why this is personal to me. May 17th, 2017, he was diagnosed. Prior to that, he started exhibiting those classic symptoms. He was 7 years old. All of a sudden, he started wetting his bed again, became very irritable, weight loss, fatigued. So I took him to the doctor for a regular checkup to find out what was going on. They immediately checked his blood sugar and checked his urine. He had ketones in his urine and his blood sugar was close to 400. We were immediately admitted into the hospital. We stayed there about 3 days to learn about our new normal. Right now, he is a healthy, amazing, fun kid. Nothing slows him down. We just have to do things a little differently. If you would like more information about type 1 diabetes, you can visit the JDRF website or the Beyond Type 1 website. Thank you for tuning in.